Today in Mental Health Matters, we're focusing on how the pandemic has affected our mental health. The physical toll the pandemic took on our mental health crisis really is evident. In March of this year, the World Health Organization reported worldwide anxiety and depression increased by 25% in the first year of the pandemic. Ohio health psychiatrist Dr. Megan Shabbing joins us this morning to talk more about this. That World Health Organization stat is really eye-opening, and you and I have talked about the pandemic's toll in our Mental Health Monday reports. Tell us more, Dr. Shabbing, about some of the things that you're hearing from people who come to see you.
I think what we've really been seeing for the past few years since the pandemic first started is we kind of have two separate groups of people. We have people who already prior to the pandemic struggled with mental health problems like depression or anxiety. And with all of the challenges of the pandemic, those problems became so much worse. And then, we have the second group of people who never struggled before, who suddenly found themselves worrying excessively, feeling anxious, feeling depressed, not being able to enjoy things. And, we strongly suspect and we know, in fact, that a good part of this is due to the social isolation that many people experienced during the lockdown, but also all of the stressors that went along with having to worry about a pandemic, having to worry about our kids, having to worry about our friends and families, and not being able to be connected.
And what can you tell us about whether certain demographics were hit harder by certain disorders than others?
Well, definitely, we know that kids and adolescents were a huge group that really suffered even more than others during the pandemic. The American Academy of Pediatrics has actually declared a national emergency when it comes to mental health in our kids. And if you think about it, for children and adolescents, it's more important than ever that they be connected to one another. So having, 1 to 2 years of not being able to be together in person, having to wear masks, not being able to run around with one another, that's really taken its toll. I think the elderly also are a very at-risk group because many of those people are already isolated. And then when the pandemic hit, that isolation became even worse and they weren't able to have the kind of socialization and get access to the people and places that would really help to improve the quality of their lives.
We talked a lot about disparities in the pandemic. Can you talk about how that relates to access to mental health care?
Absolutely. Can you think about being in the middle of the pandemic and not having access to a phone or a computer? I mean, this is the way that many of us stayed connected during the lockdown. And for people who don't have something as basic as internet or a phone or a computer or an iPad, this isolated period, it was just devastating. They had no way to communicate. And then you think about people who, were single parents in the middle of the pandemic and weren't able to stay home with their kids because of their jobs, and then ultimately had to lose their jobs to be able to be at home with their children to make sure that their kids, could get through the day. There were so many different ways that people, who have less money, less access to resources really suffered the most.
And so those then are the areas where we have to take the conversation and turn it into action.
Definitely. We need to think about, access to internet, some of the basics, access to healthcare, access to childcare. We need to find a way to make it more equal where when something like this happens, everybody has access to what they need and everybody's able to stay connected to some extent.
All right. Dr. Megan Shabbing, thank you so much for coming in and being part of the conversation this week. 10 TV is focusing on mental health. We will also continue this tomorrow, and we'll talk about screens and social anxiety. You can find a complete list of resources and content at 10tv.com. Just click on the Mental Health Matters link.